Hey everyone, it's Kim. Welcome back to Unmasking Mental Health. We are continuing to talk about the things people don't say out loud. Today, we need to talk about the assessment hangover. Now, before we get into the story, I want to be really clear. We know that the professionals on the other side of the desk, whether they are nurses, practitioners, or therapists, are doing their best. We know that mental health services are facing extreme backlogs and low funding. When they make us fill out the forms or go through the triage calls, they aren't trying to make it difficult. They have to do it. They have to make sure they get us to the right team, because the waiting lists can be months or sometimes years long. But two things can be true at the same time. It is true that the system needs these assessments to work. And it is also true that for the patient, for us, the process is exhausting. It is a marathon of opening up your wounds to strangers over and over again, just to get a place in line. I want you to listen to Alex. This is what it feels like to navigate that necessary but brutal process.
I'm sitting in my car. The appointment is over. I should be relieved, right? I finally saw someone. I finally got into the room. But I don't feel relieved. I feel hollowed out. I've been working up to this day for months. It started with that form. You know the one. The questionnaire they send you before they even agree to put you on the list. I sat at my kitchen table 3 months ago, crying over a cup of tea, trying to summarize the worst years of my life into little text boxes. Writing it down felt like cutting myself open. But I did it. I know they need the data to see if I meet the criteria. I sent it off. Then came the phone calls. And that was almost harder. It wasn't just admin. It was a triage assessment. A clinician on the other end of the line who needed to assess my risk. They were kind, they were professional, but they needed to know the details. So I had to stand in my hallway and open up my chest to a stranger on the phone, just to prove I was in the right queue. I remember hanging up that phone and shaking for an hour. I thought, okay, I've done it. I've told them. But then came today, the face-to-face assessment. I walked in there. The practitioner had my form. They had the notes from the phone call. It was right there in front of them. But they looked at me and said, "So, in your own words, tell me why you're here today." And I had to do it all over again. I had to use my voice to say the things I had already painfully written down. I had to watch them type while I described the panic, the sleepless nights, the things I've never told my friends. I felt like I had to perform my pain well enough to convince them that I deserve to be on the waiting list. It's the repetition that kills you. It's the fact that you can't just say, "I'm hurting" once. You have to say it to the form. Then you have to say it to the triage team. Then you have to say it to the assessor. By the time you walk out of that room, you aren't just sad. You're traumatized by the process of asking for help. You've had to rip the scab off 3 different times for 3 different professionals, and you still don't have a therapist. You just have a confirmation that you're on the list. And now, they said I meet the threshold. They said I'll get a letter regarding the waiting times. So I'm sitting here, shaking, feeling physically sick, knowing that I have to go home and pretend to be normal. I feel like I've been stripped naked and examined under a microscope, and then just handed my clothes back and told to wait. I'm so tired. I'm so tired of having to hurt myself just to prove I need healing.
Thank you for listening to Alex. I know so many of you watching this are nodding along. We tell people to reach out, but we don't acknowledge that the hand reaching back is often tied up in red tape. If you are currently in that cycle, filling out the forms, taking the triage calls, retelling your story, please know that your exhaustion is valid. You aren't being difficult or oversensitive. You are navigating a system that requires you to be vulnerable over and over again. If this story felt like yours, please hit the like button and subscribe. It helps the channel grow, helping us find the others who are waiting for that letter. And share this with someone who doesn't understand why just getting an assessment leaves you bedridden for 2 days. Take care of yourself tonight. You've done enough. I'll see you in the next one.